Due to the smoking, the emphysema disease occurs to the person. And in this emphysema, the alveoli are going to very hard. Why? Because the fibers develop in the alveoli. Due to the development of fibers, the alveoli containing collalis. Collalis means it's a very hard, tough stone-like. This is called as emphysema. Emphysema. And now we are going to discuss about pneumonia. 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 This is a pneumonia. 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 It must affect with a bacteria. Bacteria called as Streptococcus pneumoniae. Streptococcus pneumoniae. Streptococcus pneumoniae. Streptococcus pneumoniae. Pneumonia affecting with a bacteria, that is called as the Streptococcus pneumoniae. Not only bacteria, virus also affect this pneumonia, and some protozoans also affect this pneumonia. Virus and some protozoans affect this pneumonia. Virus and some protozoans affect this pneumonia. Due to the pneumonia, due to this disease, lungs filled with water, lungs nothing but alveoli, filled with water, lungs nothing but alveoli, filled with water. When the lungs filled with water, the person not able to respirate, breathe properly and perfectly. If lungs are empty, then only the air enters into the lungs. If lungs filled with water or mucus, the air does not enter into the lungs. That's why the blood does not receive any oxygen. It won't send any carbon dioxide. Due to that, the person goes to die. That's why here you can take pneumonia. It affected with Streptococcus pneumoniae, bacteria. Not only this bacteria, virus also affect this pneumonia. And some protozoans also affect the pneumonia. Fungus also affect the pneumonia. Due to this pneumonia, lungs or alveoli filled with water. Lungs and alveoli filled with water. And due to this, the person does not respirate properly and perfectly. And due to this, the person goes to die. This is about the pneumonia. And now we have to discuss about bronchitis. Bronchitis. Inflammation of bronchi and bronchiole. 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 The bronchitis disease occurs. Bronchitis. It is the inflammation of bronchi and bronchiole. What is the inflammation? Due to this inflammation, the space present in bronchi and bronchiole reduce. Due to the reduction of bronchi and bronchiole space, the person not able to breathe perfectly properly. The bronchi and bronchiole must be swell. Here you can take the bronchi and bronchiole. They must be swell. When they are swelling due to the inflammation, the space is going to reduce. Here actually you can take this is the bronchi And the bronchi divides into bronchioles like as this. Bronchi divides into bronchioles like as this. Due to the inflammation, allergens, it must be swell. When it is going to swell, the space must be reduced. Here you can take the space reduced. When the space reduced, the air does not enter into the alveoli perfectly and properly. And due to the swelling, and here the mucus layer also producing here. Due to the mucus, the sputum will come. Pelgium, nothing but sputum. Sputum or pelgium. What is that, Nana? Temda in Telugu. The sputum or pelgium will develop in this bronchi and bronchiole. When the sputum or pelgium or mucus developed in this, or it is going to swell, the space is going to reduce. When the space reduces, less air enters into the alveoli, and due to this, the person going to get the problem. This is about the bronchitis. Inflammation of bronchi and bronchiole is called as the bronchitis. Due to the inflammation, the space present in bronchi and bronchiole reduce, and due to the inflammation, the bronchi and bronchiole must be swell. When the bronchi and bronchiole must be swell, the space reduce, and sometimes the mucus also which accumulate in this bronchi and bronchiole. Due to the accumulation of the mucus, the space reduce. Then the person not able to breathe perfectly and properly. This is called as bronchitis. This is called as what, Nana? Bronchitis. And the three types of diseases are called as COPD diseases. Three types of disease of respiratory system called as COPD. 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 CO means chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease, COPD. Three types of diseases are called as chronic obstructive pulmonary disease. Important for need bit, Nana. And they are called as asthma, emphysema, and the chronic bronchitis. These three diseases are called as COPD diseases. Chronic bronchitis means what, Nana? Severe bronchitis. Generally, if we will take the bronchitis, if once or twice the bronchi or bronchiole must be inflamed, a severe cough will come. But the chronic bronchitis, it is completely severe. More times, it must be repeated. That is called as the chronic. The chronic bronchitis is called as a COPD disease. Important for NEET. It was the question in previous MSET and NEET also. Which diseases are called as COPD diseases? Here you can take asthma, emphysema, chronic bronchitis. These are the diseases. These diseases are called as COPD diseases. And the occupational respiratory diseases. Due to the occupation, the respiratory disease will come. Due to the work, the respiratory disease will come. They are called as, it's a common silicosis. The silicosis occurs, the person who will work in the quarries are there. If we will take the which on stones, hills, they must be crushed. That crushers are called as the quarry. The person who will work in the quarries or crushers, the person will affected the silicosis disease. Siderosis disease. The persons who will work in the asbestos industry, the person affected the siderosis disease. And the block lung disease, the person who will work in the coal mines, the person affected the block lung disease, silicosis, siderosis, and the block lung disease. These are the occupational diseases. And this is about what, Nana? Respiratory system. And some new words also present. It is not present in our textbook. I would like to give that. Listen to me and note down that. Eupnea. Eupnea. Eupnea, nothing but normal breathing, Nana. Normal breathing. Orthopnea. Orthopnea. Orthopnea, nothing but painful breathing. Painful breathing. Painful breathing. Hyperopnea. 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 Speed breathing. Speed breathing. Speed breathing. Hypopnea. Slow breathing. Slow breathing. Apnea. No breathing. No breathing. These words are important, Nana. Eupnea, normal breathing, and orthopnea, painful breathing. Hyperopnea, hyper means speed breathing. Hypopnea, hypo means less, slow breathing. Apnea means no breathing. Tachypnea, very slow breathing. Very slow breathing. Very slow breathing. These are the words which are related to the breathing and respiratory system and important for NEET purpose also. The eupnea, orthopnea, hyperopnea, hypopnea, apnea, tachypnea. Tachypnea, very slow breathing. Apnea, no breathing. Hypopnea, slow breathing. Hyperopnea, speed breathing. Orthopnea, painful breathing. Eupnea, normal breathing. This is about the respiratory system, Nana. Tomorrow we have to discuss about circulatory system. Circulatory system. The chapter completed, this respiratory chapter completed. Okay, Nana? Children,